Good evening, everyone, and welcome to the August 15th edition of Beyond the Data. And of course, we have Carrie, Benton with us here today, and we also have Josiah Lanning.
Hello.
We've heard from Josiah before at where I first met him was at the testimonies at the State House early in the winter there when we were talking about SB 22 and 311 and all those things.
When it was snowy outside.
And it was still snowy.
It was snowing outside.
And so, he's here to just join us and chat about also what we're talking about, which is essentially the some of the events of the last week and a little bit of the data. So Carrie, if you want to introduce him further, by all means.
Absolutely, I can do that. So Josiah is absolutely wonderful. I was drawn to Josiah actually because he has the best service canine ever in the world. So I like him for his dog. No, he has fantastic ideas, fantastic policies. He is very much in tune with what Ohioans are dealing with because he's dealt with it on multiple levels of many different things. He's running for, do you have the...
I do.
Yep, Josiah Lanning for House District 22. And of course, I know absolutely zero about politics, but I know if I had to pick one, I would want Josiah because I just believe that he is relatable every sense of the word. So I'm going to go ahead and let Josiah, as I'm looking through his wonderful page, if you guys haven't done that, I would suggest going to lanningforohio.org and you can read all about Josiah. Looks as if he will, or he already did announce his candidacy for Ohio District 22. And Josiah, if you want to go ahead and give us your take on a few things. What are you standing for, and why are you running for this position?
So I'm running because I think for the past year and a half, we've seen the size of Ohio government grow larger and larger and larger to a point where I think the everyday common Ohioan doesn't recognize it anymore. When the government has the authority to tell you this business can open, but this one can't, by the way, your church doors should be shuttered too. And then you have sheriff's offices that have delayed concealed handgun licensing because of COVID while they allow chaos to run rampant through our streets. I think it's time to reimagine government. I know progressives like to get on TV and talk about reimagining the police. Well, how about we reimagine government to a government that's more efficient and works better for the people? We're not supposed to have politicians. We're supposed to have representatives, which theoretically should be public servants. That's not exactly what we have right now.
Absolutely.
Yeah,
Absolutely.
definitely. All of us, none of us are political. I mean, at least Carrie and I are not even remotely political, and the experiences we've had over the last year and a half with our politicians has been frustrating, to say the least.
Yep. But I think it takes somebody remembering where they come from in order to be effective in where they are going. So I can't imagine a better person for the job. And I don't know anything about campaigning, but I have a big mouth, so I can campaign that way with my mouth for you.
That's perfectly fine. I appreciate that.
So, and I think when is the voting for that?
So the primary for that is in May, beginning of May. And then after the primary, obviously, just like every other general election, it'll be next November.
Okay.
But obviously, goal one right now is to get through the primary. So we're working on talking to constituents and trying to get votes and get people on the campaign and working through neighborhoods.
So, well, and I know, District 22, now that I know where that is actually located. there are several rural areas that a lot of
Right.
people don't hit, and they don't think of, and they don't
Right.
include.
Yeah,
So
there's a lot of areas that are neglected. Um,
yeah,
or kind of the district exists, but oftentimes it's a district that's avoided because nobody wants to go through those neighborhoods. Nobody wants to go talk to those people. Currently, the holder of that seat is Representative Dave Leland. It covers some of Westerville, some of Columbus, and some of Upper Arlington.
All
wow,
right. So this is who we have today, and
yep,
Josiah is always good with.
Sorry, my four-legged canine is passed out next to me sleeping. He might
yeah.
have to
I'm
whoop a
truly
couple
disappointed
times.
because I feel like it's a dual seat.
It is.
So if
Oh,
he
and there,
doesn't,
and if
yeah.
you go to my
So
website, there's a Meet Kylo tab for everybody that hasn't met Kylo. There's a little section just for him.
yes, I had the pleasure of having lunch one time with Josiah, and I was like, oh my goodness, I'm going to take you home because of Kylo. So everybody's going to come home with me because you have a dog. So, but I
All
think we
right.
can probably move on to Kathryn's. I might have to cut out early. I do have some things going on at home. So if Chip needs me, if I have to just wave, then doesn't mean I won't be back, but I might have to cut out early just to let everybody know.
All right. Well, we hopefully will hold it a little shorter than lately. So as we may or may not know, because they aren't as publicized as Governor DeWine's COVID press conferences, there are actually two ODH-based press conferences last week. The first one was about be afraid of the Delta variant, except for don't be afraid of the Delta variant if you're vaccinated, because the vaccines work, but then they don't, so you need to be afraid. I think I'm basically getting it here. And then on Friday, there was the ACIP meeting that the CDC allowed boosters for the immunocompromised. And so there was a short little press conference there about the addition of the boosters for the immunocompromised. But Dr. Vanderhoff assured us about the efficacy, again, of the vaccines against the Delta variant, and that there's absolutely no reason to be concerned that, or not no reason to be concerned, but, no reason at this point in time to think that we would need boosters. But it got a little bit circular these 2 days. They did get a lot pretty circular in terms of how what we were talking about in terms of efficacy against the Delta variant and whether or not there would be boosters necessary. So one of the clips that I wanted to start with were about this whole business of the Delta variant, and they keep talking it up as something really scary, something to be afraid of. And the usual, we gotta be afraid. So here's a couple little clips about him talking about the Delta variant. Let's see if I can find it. Where'd it go? Do I not have it in here? I might not have. Oh yes, here it is.
COVID-19 is now more contagious than the common cold or the flu. The Delta variant also appears to be more dangerous than prior variants. We now have data from Canada and Scotland showing that those infected with the Delta variant have a higher likelihood of needing hospitalization, and from Singapore, that there may even be more risk of pneumonia, ICU admission, or death.
So this is a graph that I was working on over the last few days. This is all data straight from coronavirus.ohio.gov. Straight from their CSV files. It's not any data that's being collected day to day. This anybody can do this and just pull it down. So what did he just say there? He just said that it's more contagious than the common cold, and it's more dangerous because he cherry picked out Scotland and Singapore. So how valid is cherry picking out potential research from other locations that is not here? So I made this particular graph to kind of look at, they did this before with the B117 variant. They talked about, oh, this thing is so much scarier, it's so much more contagious, it's probably more virulent, it's all this stuff they were saying about it. And so I made up this graph here so you could kind of get an idea of when we're talking about variants and the severity. What these three lines represent are, the green is the cases, and it's also on a different scale. So the cases scale is over on the right because there are way more cases than there are hospitalizations and deaths. If they were on the same scale, we wouldn't be able to see hospitalizations, death. So hospitalizations and deaths scale is over on the left, cases is over on the right. We're talking about nearly an order of magnitude difference, actually more than an order of magnitude difference. So what we see is the cases and the hospitalizations stick pretty closely together, but the deaths don't after the original variant went away. And actually we see the original variant here, the deaths just drop away, even though the B117, they made a big deal about it, going, oh my goodness, their hospitalizations, their cases, it's ripping through our communities and all that. And hospital cases will lead to hospitalizations, will lead to deaths. Well, we already see this disconnect here where no, they don't lead to deaths anymore. And we also see this even more extremely with the Delta variant. And they have been adding deaths to the very near term, where, before we used to have situations where we would have deaths not be reported for months and months and months after they happen. That's not the case anymore. If you look at the CSV file, they are adding new deaths, and they are added basically in the last couple of weeks. They don't backdate these things. These things are pretty current.
So I guess I would look at, when I think about the whole variant situation. So we have variant of concern, which is currently what we have with Delta and a couple of the other ones. But it's being treated in Ohio. Am I getting feedback, or is it just me? It could be
just a little bit.
Okay.
A little bit, not much though.
It's being treated as if it's a variant of high concerns and high consequence. So VOHC, which is the next one up. If that was the case, then you would have demonstrated failure of diagnostic test targets. Are we there yet?
No.
Okay. Evidence to suggest a significantly reduction in vaccine effectiveness, a disproportionately high number of vaccine breakthrough cases, or very low vaccine-induced protection against severe disease.
So the fun part is if you're looking at this thing, I mean, I don't even know how they're really determining it anymore. Because if I look at this graph here, I see the death graph, and I just see Farr's law. Right. I just see it goes up, it goes down, and it continues on down. I don't see an effect either from the combined hospitalizations and cases for the B177 or the Delta. So how are they determining whether or not it's more severe or not? I mean, this is where it just doesn't make any sense to me.
Well, it also doesn't make sense because I think, at least it appears to me, they've thrown out all common sense of virology, because we know the more communicable something is, usually the less deadly the virus is. A virus is alive.
Well, not alive.
Doesn't want to kill its host. That doesn't make any sense.
Well, it doesn't have wants, but if it kills its host before it can transmit,
right,
it can't transmit, and so therefore it ceases to exist. And so we have the situation of, if it's both highly transmissible and highly virulent, or makes people super ill, it's not going to transmit. I mean, it's not going to go very far. It might make those people right in the near range really sick and kill them, but it's not going to keep going. So, and this is very classic evolutionary biology when it comes to the evolution of human diseases as they come into a population. It goes towards higher transmissibility, lower virulence. And that's the fun part is we see exactly that. When they're hyping up the B117, they always talk about it's more contagious. But it's interesting that he says it's also more severe, and yet the data is not showing that.
Right, and I think that's where I was getting at. So we have the, if you and anybody can go to the CDC webpage to say what makes a variant of concern versus a variant of high consequence. And of the four things that makes a variant of high concern. Now, if there's a variant of high concern, we do need to take notice, because that is something that we need to address. But you would have to meet the significantly reduced susceptibility to multiple EUAs or approved therapeutics, more severe clinical disease, and increased hospitalizations. So, and you have to meet all four of these criteria, as well as the demonstrated failure of diagnostic test targets. Well, we know that. And then the evidence to suggest a significantly reduction in vaccine effectiveness, disproportionately high number of vaccine breakthrough cases, or very low vaccine-induced protection against severe disease. So that one was the one that they were discussed heavily during the ACIP meeting, if anybody got the opportunity to watch it. Okay. And that's the only questionable one right now. The one of the issues for Ohio is our therapeutics aren't consistent. Not because they're not available, they're just not consistent. I don't know each provider's situation. Some facilities don't even have a protocol. They're flying by the seat of their pants. But again, it takes so long for that Delta to come back around to even know that there was a specimen, not necessarily a patient, but a specimen in that geographical region which was positive for Delta. Then you have to backtrack and say, well, how were they treated? Well, unless you know how they were treated and the outcome, then you don't know if the therapeutics are working or not. And since there's no consistency there, same thing as we've dealt with this whole entire time, Ohio has no consistency.
Unfortunately, I hate to say this, but I think we talked about this the last time I was on another show with both of you.
I think so.
I don't think any of this is ever going to end until our elected representatives and the people as a whole say enough.
Yep.
We're just going to keep pushing this on and on. Right now it's the Delta variant. Hey, if we keep going, maybe we'll get to the Freedom variant by the end of the year and we can just stop all this. That would be ideal.
No, there will be no Freedom variant unless we make it happen. Yeah. So, and this graph, I'm just, while I pull it up here, this is just simply zooming in. So you see just these last two variants and just how kind of ridiculous it is that as you listen to Dr. Vanderhoff and you listen to the words he says, and you know that this is what we have in the state of Ohio. This is our data. This right. is the data that his department produces, and we see, okay, what are we looking at here? We're looking at a situation where it looks like, yes, cases and hospitalizations increase and then decrease and then increase, but deaths just peter out. They don't seem to have any relationship whatsoever to the increase in cases or hospitalizations, which is either a situation of it's a less virulent virus, or again, we're testing people who are not actually ill, but rather testing positive because of whatever versions.
Well, so is that blue? Is that blue hospitalization?
Blue is hospitalizations, yes.
So we have more hospitalization than cases?
Yes, because those... No, hospitalizations and cases. So hospitalizations is the left-hand scale, and cases is the right-hand scale. Because if I put cases, I put them on the same scale, you wouldn't be able to see hospitalizations and deaths at all. They'd be just kind of like a little line at the bottom, totally flat line at the bottom. So
I was just curious because that blue line was popping up on the left-hand side, and I was like, wait a minute, why do we have more hospitalizations than cases? And I see some comments real quick in the comment section about the percentage of beds full based on staff. Absolutely. So when we hear at 2 capacity, that might not necessarily be at 2 that facility's capacity, but what they have for a provider to patient ratio. So all the more reason that now is not the time to be pushing providers that have worked their tail end off for the last 18 months out the door.
It's a little bit, it's asking for it. It really is. I mean, and still right now, if you go to the coronavirus.ohio.gov hospitalization dashboard, it shows that we've got lots of capacity. I mean, we're definitely over capacity for this time of year under normal circumstances, because we're somewhere that looks like around 75-80% capacity that's being used right now, and actually down to 70% that is being used. But because they are essentially firing hospital workers, I have to imagine that the number of available beds is going to decrease. And so if they do go forward and fire people for refusing the vaccination, I do know that the total number of beds has fluctuated in the past, and I'm curious if they're going to actually acknowledge that. We also know from last winter that they are perfectly willing to talk about overwhelmed hospitals that are just one hospital that's overwhelmed, while all other hospitals in the region are doing just peachy.
And so guess what? Now we're back to square one of reason for lockdowns.
Yes, we are.
But like I said,
it's all self-induced.
An ridiculous amount of time between Friday and Saturday, and 2 different facilities and an emergency room where we were the only ones in there. For most, right when Chip was being discharged, then there was another one brought in, nothing COVID related for either. But they were trying to decide who was going to take that shift, because it was the same ones that had worked prior. And the one said, no, I took HCV time, which is hospital convenience time, yesterday. Somebody else can take it, because there was nothing for them. They were overstaffed for that shift. So there was a lot of discussion for that. But it's also a facility, neither one that we were at is mandating the vaccine for their employees. I have decided I will not go to one that mandates it. I'm not going to do that for multiple reasons, but one of them is just because if I'm going to stand with them, then I can't support the aggressor, whoever is, pushing them into a corner. And JCO and state and anybody else, administration surely wasn't concerned when they were only giving them 1 mask per week and a doggone trash bag to wear going into COVID rooms. Then they surely cannot expect them to set themselves on fire now that there's a vaccination available if they choose not to. Because what would have happened if they chose last year not to go into that room because they were not provided with adequate PPE? It would have been abandonment. And we would have wanted to burn them at the stake. So the least thing we can do, at the very least, is support them this year. But that's my hill that I will die on. And I think everybody has to have one of those.
I was just talking to somebody about that earlier today. It amazes me how last year we heralded nurses as heroes, and now we call them villains. And then on top of that, we're appalled by Andrew Cuomo violating women for them to keep their job and for career advancement. We're so appalled about that, but we have no problem with violating bodies of nurses, right, doctors, and let's be honest, we're getting to the point of every employee. It's heading that direction.
Yeah. Oh, absolutely. And I can tell you what, at least the area which I'm in, we just won't have a facility. That's exactly what will happen. I mean, but if you take out your laboratory portion, and every employee is important, they have a job to do, and they're a piece of that puzzle. But if you take out your laboratory, what are you doing? What can you do if there's no lab?
Nope, you can't.
Well, I guess we won't have all the COVID tests anymore.
Well,
No,
you
those are outdoor. Those
Oh,
are
okay.
companies. Those are
not always. I mean, each facility now has their own test developed at their own facility.
but
But
there's always commercial. If they
but
ever stop with the labs, you've always got commercial labs
oh,
to
absolutely. But who's
Yeah.
going to run that test? If you
this.
need to do blood work, who's
Yeah.
going to diagnose something other than COVID? You literally have taken out your foundation. So it's, I hope they're not cutting off their nose to spite their face. I'm still in a position to where it's not mandated. So I surely don't feel comfortable saying that somebody else should be mandated because I can't do that.
And the crazy thing about it is, this is another graph that I've been working on. I posted this kind of a version of this a couple days ago, and I think this version is actually a lot better. So we're here sitting talking about mandating a vaccine, and the argument that the hospitals are making is that the vaccine protects the patients, and everything's about protecting the patients. That's the whole point. And this was actually brought up at one of the press conferences in the last week, that it's protecting the patients and all that. And we know from press conferences for months and months and months, both Governor DeWine and Dr. Vanderhoff and the cavalcade of whatever kinds of doctors and stuff would come on saying, we know that the vaccine is what has caused the reduction in severe outcomes like hospitalizations and deaths. So this particular graph is showing, again, hospitalizations and deaths, hospitalizations being the blue line, deaths being the red line. And the gray shaded area is showing the percentage of Ohioans who are fully vaccinated. And this particular graph really shows that the entire spike was done by the time even the first people were getting vaccinated. I mean, you can kind of see there's like this long tail here. This thing here, that's kind of artifacty because of the way that Excel graphs these kinds of things. That little bar right here actually represents like one person who's officially fully vaccinated. That's what this little line here, and just the way it graphs it, I couldn't make it smaller than that, but that's like one person who was vaccinated in that time frame. So really it started about here, where we started just having a few hundred people fully vaccinated. And even then, we peaked out now at 46% or so of residents of Ohio are fully vaccinated, according to them.
And
so,
we've had how many positives?
I don't know.
A lot?
A lot. I think
Okay.
we've had we're definitely over 1 million positives in general. But yeah, so this kind of feeds into one of the other comments that our dear new director of health, if he gets confirmed, said during one of his press conferences. And this is what he has repeatedly said now for several weeks, which is about the unvaccinated and their proportion of the deaths and hospitalizations. So here comes Vanderhoff.
Now, compare that with the long-term effects of COVID-19. The most severe and irreversible complication, of course, is death. Right now, more than 99% of all COVID deaths in Ohio have been among those who aren't fully vaccinated. Likewise, it can make people of all ages very sick. That is, COVID can make people very sick, finding them in the hospital or the ICU. And more than 98% of our hospitalizations for COVID have been among those who have not been fully vaccinated.
So right here, we can look at this graph and say, well, duh. I mean, the vast majority of hospitalizations and deaths occurred long before even the first few individuals were being vaccinated. And in fact, if you kind of look down here, their argument has been that it prevents the severe outcomes, right? Well, we know from the last graph that the hospitalizations and case numbers and hospitalization numbers track pretty much, they follow the same path. And we see that the deaths are down way low. So if we're going to go, but the thing about science is, if you do real science, you can't prove anything. It's not about proving anything. What it's about is refuting things. So when I make these graphs, or if you see these kinds of graphs come up, a lot of commentary will come back and say, well, that doesn't prove anything. And they're right. It doesn't prove anything. But what it does is refute. What this graph does is it completely refutes the entire concept that it was vaccinations that turned the tide of COVID, of the deaths and the hospitalizations. Because if that were the case, if we accept that premise that it was the vaccinations, the fully vaccinated, who turned the tide, then one of two things we should see. Well, we should see something. We should see some kind of evidence in the data. So we should see, first of all, we shouldn't see it decline like that before people were even fully vaccinated. If we see that, that means something else is at play. Yes, okay. And then you can go on and say, well, maybe also vaccinations did it as well. Okay, so if you take that premise, then you have to say that when we see this increase, that means that whatever, if the vaccinations are what were making the difference, you should see that this is the amount that's sufficient for making that difference. Am I making sense?
Yes.
Okay, good. I don't even know if I'm making sense. But if you look at this amount, if what they're saying is the reason that the B117 had less severe outcomes is because of vaccinations, then this amount of vaccinations is enough to make the difference. And if you look what that amount of vaccinations is, we're looking at maybe 8% of the total population of Ohio was vaccinated, which is fantastic. That means, well, if it's the vaccinations, then we're good already, right? Because we've already had enough people. 8% is enough for making the difference. But I mean, this is it's ridiculous on its face, is what I'm trying to say. Am I making any sense here?
Yeah, you are.
I was just
but I
looking at
guess
the graph while you were talking.
Yeah. My favorite part of this is because I can talk to Kathryn at any time, which I love her dearly too. But the comments. So I am listening and I am paying attention, but I love the comments every time that we do this one. It makes me feel very connected. But there are some fantastic comments, and I know Kathryn has a hard time multitasking.
I'm not a multitasker. I
yeah.
don't. I focus on one task at a time. I do that one task well. I don't do multiple tasks.
Josiah, I have a few comments that want to know, where can they find your shirt? Where can they get your shirt?
So I got this from a group that I haven't been involved with as much anymore, but it was back when masks were really bad, when they were really bad about asking for masks. So we literally just took the quote from the Dr. Seuss thing that somebody did from Facebook, took it and put it on a shirt.
Okay.
But I will not wear your mask. Yeah, I love this shirt. And it's becoming more and more applicable because we're going right back down that same path again. I saw one of our legislators yesterday at an event that I was at, and I had like 5 minutes to talk to him, and we were talking about how things are, and I said, don't get me wrong, I appreciate all the work you did on Senate Bill 22 in working with me, but I'm going to let you know, in case you haven't been told, we're right back to square one. Except now the problem is there's no state order, so there's no specific exemptions. Each business can make its own rule, theoretically, and all you can do is argue back and forth with them because there's no statewide exemption.
Yep.
So in many ways, it's a whole lot worse.
I had exactly that.
Meanwhile, the governor sits behind his desk and says, I didn't do it. Private businesses made their own decisions, not recognizing he created the environment of fear that has allowed all this to go on for a year and a half.
Yeah, you're right. And I know that there's that I just got a question sent to me today about is the health department keeping a database of what kids are and are not vaccinated for COVID because their school district is doing the unvaxxed only has to quarantine. And that's right in Andy Brenner's, uh, the
Senate
one
bill.
about the EUA, Senate
Or is it?
Bill 244, House Bill,
Oh,
Senate
the
Bill.
244. Yeah.
44. Yeah,
Right. It
that
passed.
doesn't go into effect till October though.
Yeah.
Right. But it doesn't. But, you know, typically businesses or entities, if there's a law that's been passed, even before it goes into effect, they start to prepare, like to follow it, follow that law because
I
they
think
know it's coming.
I think the reason we're not seeing that now, I agree that's usually how things go, but I think the reason we're not seeing that now is because businesses throughout the state have been told by the governor that they have the ability and the authority to tell people what to do. So they're not going to give that authority up until the very last day. So on the 89th day, they'll probably start writing a policy.
So I have a question then. Um, so what happens if, because I don't know political things, what happens once it's passed, any bill, does that bill then go to, so that one pertains to schools, the section of it. Do they pass it out to every superintendent, or how does anybody know unless they're checking or listening that a bill has even been passed that may affect their business or their school or their group or club?
So theoretically, school administrators and people on that type of authority should have somebody overseeing policy, or legal counsel would be the people that would gather that up, read through it, and send them a summary. That's typically how things usually
Okay.
work. But
Okay.
who knows with the way things have been going lately? I think everybody thinks they're experts now, so who knows what's going on?
Well, and
Okay.
also, I mean, the media and they do. The state of Ohio puts out, information, but the ODH and the rest in Governor Wine's office are only going to put out information about the bills that they like and that they
Right.
want people to know about. And
Yeah.
so it is really in the hands of the constituents of the different areas to make sure that your local businesses, your local school districts, in the case of 244, is that you've got to know that this is there. But I believe with 244 they were briefed on that. I'm not exactly sure though.
Yeah, that I don't know for sure. But I mean, this just points to, and I'm sorry, yes, I'm going to plug it again. This is why we need House Bill 248.
Yes.
Because 244, what we were just discussing, is just for the kids in school. So if you're not in school, you're not covered. And I
Right.
think one of the things that we're a road we're heading down if we're not very careful, and I haven't decided whether or not it's intentional, is we're still pitting one group against another. So we're giving certain exemptions to kids that are in school, but we're not giving it to healthcare workers. We're not giving it to other employees. We're not giving it to other citizens. So now you have those people wondering, well, they can have it. Why can't I? Am I less of a citizen?
Right. And I agree with that 100%.
And the reverse, because again, if you have am I less of a citizen situation, and in the reverse situation you have the thing of, well, if they can mandate it on healthcare workers, then they
Right.
can mandate it on everyone. And so it is this kind of battle between the two.
Yep. The other one I saw, are they still using the discontinued PCR test? There might have been, there was two different PCR tests that were, one will be shelved or sold at the end of this year, and then another one was discontinued in order to switch over to the multiplex test. So PCR as a whole was not discontinued. There's nothing abnormal about what they're doing. So yes, PCR tests are being very much so used. For example, University Hospitals has their own PCR test. They do not purchase from others. It's made in-house. So they have their own EUA, their own PCR test, and that's what they use. That was not recalled. We've used, or not recalled, I'm sorry, it was not discontinued. PCR has been used for years and years. It's not specific to COVID. So, yeah, PCR is still being used.
And it's there's it. I mean, unfortunately, we addressed this a few weeks back as well when all this went down, and it bears repeating though, because I do see that comment popping up quite a lot that, well, they've said that PCR doesn't work. Well, no, PCR works exactly the way that it's designed to do, which is to detect genetic material that could be in a sample, like a swab sample or a spit sample or whatever. So it does do that, and they do not say that it doesn't do that. They also do not clarify about what should be the cycle threshold limit, which is how much of the genetic material is present in the sample. Though we can actually get an idea of what kind of positive tests we're getting based on the number of tests that the state of Ohio is not sending to the CDC for genomic sequencing. I looked again. I did I post today? I might have posted today. I don't even know anymore. But what I looked up on the CDC today about the variants of concern, again, Ohio didn't make the list yet again. No. We have not sent in 300 samples over 4 weeks. The 4 weeks that they talked about, I checked it. It was like 8,400 or 8,500 new cases in those 4 weeks. And we could not manage to get 300 samples with a high enough cycle threshold on them to be sent for genomic sequencing.
Well, not only that, but I mean, that's a multiple layered thing. There's the way that they're packaged, the way that they're collected, the CT threshold, and the geographic location. And I don't know what the struggle is. I truly cannot comprehend that. But I do know that the next thought is sending some of those independent contractors from the CDC to collect the specimens from the facility and offer additional training. And some of the emails that come the way that these specimens arrive, like, legitimately blows my mind. And I've done laboratory work for a very long time, so it's nothing for God love it, I can't believe this is not butter container to have a stool specimen arrive to be dropped off with no name or nothing on it, and you're like, where did this come from? Those things happen. Or instead of taking the lid off of the urine cup and providing the urine inside, the part on top that has a needle underneath it, to pee in that, and then we have a mess to clean up. None of those things are abnormal, but when we have our labs and health department unable to count to 17 quality specimens and follow 4 simple criteria to send the specimen, it legitimately blows my mind. So you can send 300,000 specimens, but if they're not labeled, they're 6 weeks old, they're leaking all over, they're not good, they will be marked as QNS, which is quality or quantity not sufficient.
Which tells us also about, when you are dealing with these kinds of tests, if that is the level of care
right
to what they send to the CDC that they are legally obligated to do, this is where you have issues of false positives that get introduced. When you have PCR tests, what they'll do is they'll do a batch testing where you have a whole bunch of different samples all put into the machine at the same time so they can heat up and cool down, heat up and replicate. And one of the most common ways, as I understand it, that you get false positives in a PCR situation is that somebody's not careful, and one of those true positives gets kind of mixed with the other samples.
Yeah, that can happen, and you see more of that in the pooling and surveillance. I mean, there's a whole process to both. And again, PCR is just the methodology that is used. But when it's genome sequencing and variant identification, it is a process. And so I don't know what we're doing here, why we are one of the states, but I shouldn't be surprised. Ohio has struggled to follow a simple written process that a fourth grader could follow, from the whole beginning of testing. And when we didn't do it right from then, now it dominoes. And here we are, it's spiraled into, we really need, there's a whole multitude of reasons why that information is good on the surveillance side. And we can't get it because we can't get quality specimens. Like, what are we doing? I don't understand where the disconnect is. But from what I myself have experienced between that on the laboratory side, which I have utmost respect for laboratory people usually, and then just in general, this past week with the state, I don't want them weighing in on my medical decisions for my loved ones, even if it is a hangnail or a splinter. They can refrain from comment, because it's not okay, and they can do better. And that's kind of what I've echoed for a week now. But we can do better, all of us as a whole. That you're getting paid. We can do better.
Just be careful.
Yeah.
Be conscientious. Don't be sloppy, and don't try and make messy data, because that's going to hurt everyone. It doesn't matter if you're on the side of mandates are wrong or mandates are right. What we need most of all is just nice, clean data with as little variables involved as at all, so we can make those proper decisions. So going back, I saw in the comments a comment about how do we know it's the Delta variant and all that's causing the surge. So there's a couple different levels, and I believe we talked about this a couple of weeks ago, didn't we?
We did. Well. Yeah, we did. So how do we know? So what they're saying currently is in any geographical location. Keep in mind, this is a region. This is an HHS region.
Actually, this is the whole U.S. I just did the U.S. I didn't take the region.
Right. But when it's broken up, so when you hear because for weeks I'm going, where is he getting 80% from? I think I heard that comment multiple times, or read that comment from Vanderhoff, and I could not for the life of me figure out where this 80% is. And I'm still not 100% clear, but from what I've pieced together, I believe he's looking at the region, and the region isn't central Ohio, southern Ohio, Lorain County, Mercer County, Miami County. No, the region is actually multiple states. So our region, which is Region 5 or District 5.
So now I've got it up here. This is ours.
Right. So right there, yeah, if you look at Region 5, we've got Michigan, Minnesota, Ohio, Wisconsin, Illinois, and Indiana. So maybe it is 80% or 79%, and we're 1%. We don't know because we don't have quality specimens. So what they're saying is in that region, if a majority of them that are ran, those specimens, so when we look at a region or a geographical location of Delta, so our Ohio specimens should be ran with the rest of Region 5. And if a majority of them are Delta, then we're going to call that for surveillance purposes, not funding purposes. We're going to call that the prevalent variant of concern in that region.
And so, I mean, that's the other thing that I remember we talked about as well before is to keep in mind, again, these are samples that are of quality. And and also keep in mind that these last 3 weeks here where they have it, oh my goodness, the Delta variant, which is this kind of medium orange color, that is, if you get COVID, that's the COVID you get. It's an assumption. It's well, everything that we're testing for the most part is Delta variant. So we're assuming that if you have COVID, then you have Delta. But one thing that I want to point out again is because the state of Ohio is so insanely sloppy with what we call a case, that when we look at the number of cases that Ohio has, that it's not necessarily, and somebody's echoing badly there. Oh, okay.
I hear a TV. It's not mine because mine's not on, but I hear a TV.
So the other issue is these are the number of cases that came out of a PCR test that was properly shipped, that had a low enough cycle threshold. So if you're also dealing with, because you have different populations of people getting tested for different reasons, you have people getting antigen tests who are largely asymptomatic, and those don't count. Those can't be tested. Those can't be sequenced. They can't go any further. So what exactly are those antigen test positive cases testing for? Are they testing for Delta? Or are they finding small amounts of one of the others? Who knows? This is just telling us that of the cases that create symptomatic disease and a high enough viral load, and the people collecting and sending it are not too incompetent, which doesn't really have to relate with the disease, but those are the cases that are almost, I mean, looking at this, it's like, yeah, it's a pretty fair assumption to say the cases that are in this range are Delta. So if you're sick, you're symptomatic, you have a high enough viral load, so it's actually being caused by the virus, it's probably Delta. They're assuming all the other cases are that, which is maybe not a good assumption.
Right.
Depending on what we are counting as a case. Are we counting people who have RSV, who happen to be a student, as COVID? That would not be Delta.
And that's where we erred by not doing that from the beginning and following exactly the criteria that was set forth.
Data.
Yeah, that's exactly what we should have. And I want to make sure that everyone, when they go onto the COVID data tracker, so it's covid.cdc.gov, and it's the COVID data tracker, they can see anything. It's really, really, really important to scroll down to the bottom. And when you look at the, oh gosh, what is it called? I don't know what it looks like for the public on the public portal. For the variant of concern, it'll say something about variant. I don't know what you guys.
The unweighted proportions of variants of concern?
No, before you even get to that, you guys click on, it should say something about variants. If you look at whichever one says genomic surveillance or variant proportions in the US, it should say something to that effect. And it's towards the bottom. The first thing that comes up is like the whole United States, and there's pie charts. Make sure you understand that everything at the top of that, it's, because it defaults to what's called nowcast. So those are all, that's like my stuff. Those are all trajectories. Yeah. So when you're scrolling down, so these is that what you guys see?
Yes, this is what we see.
Okay, so this is a trajectory. If you're not paying attention and you haven't unclicked the MyCast Now, those are, or Nowcast, not MyCast Now, I don't know what that is. Yeah, those are all, there you go.
This is the real, this is the known, this is the solid data that has come in.
Right, so you have to make sure that you have that, go up and unclick the Nowcast if it's available. So everything underneath that, until you get to the raw data, or the unweighted proportion. That is all trajectories. So, and there's really good instructions on there too, but I've had a question about that. Like, wait a minute, this isn't matching what? And I said, well, that's because we're looking ahead. That's what they're supposed to do, is establish a trajectory. Are they right? Are they wrong? I would never in a million years, you could not pay me enough to even attempt to do a trajectory for the state of Ohio. Never. There's just not enough good quality data to do it. And I mean, yeah, that's like, I'd rather be a meteorologist with zero experience and try and guess the weather by licking my finger and sticking it in the wind, as opposed to doing anything with Ohio. I mean, it's just too difficult, and which is really sad, because I do think we have a lot of people around the state that are more than qualified to make sure that the training and the specimens are of good quality.
So one thing I wanted to do before wrapping it up here is another set of graphs that I'm working on here. And in terms of posting these things, it's been kind of a tricky situation, because I know it's an absolute given that my page will be getting shut down at some point. There's no question about that. I'm trying to get this email thing set up, and I just don't have the bandwidth in my own head to feel comfortable doing it myself. It's set up, but I just need to make sure that I'm doing it right to get people's signing up and stuff like that. And once things are kind of stabilized in that world, I'll feel a lot more comfortable posting some of my stuff that I've been putting up here. Because I don't want to get shut down before people know how to find me again. But this particular set of graphs is, again, straight off of the CSV file from coronavirus.ohio.gov. This is, there's nothing that anybody else can't do here. Anybody can do this. These are a couple of graphs based off of age ranges. And so, again, what I'm comparing here are cases, hospitalizations, and deaths. But I pulled out just one age group, and in this case 70 to 79-year-olds. So what we see in this is we see what we expect to see. Again, cases are this time cases are on the left hand side, and hospitalizations and deaths are on the right hand side, and I scaled them so that cases are exactly 10 times higher than they appear to be. So imagine the blue background here is 10 times higher. I mean, if I put them on the same scale, you wouldn't be able to see hospitalizations and deaths. But the important thing I want people to see out of this particular graph is the shape of the curves. And what we see here is that cases, the shape of the cases curve, is pretty much the same as the shape of the hospitalizations curve, which again is pretty much the shape of the deaths curve, except for right here, way down at down at the end here. Down at the end, it starts to shift off. We start seeing an increase in hospitalizations and cases, but the deaths have remained extremely low, which is a little bit surprising. And it's going to be interesting if that maintains. That'd be great if that maintains, though that's still in the near term, so we can't really say for sure if that's the case. But this is what we expect to see with an illness. These people got ill. This is what we should see. We should see everything echoing. We should see cases, and a certain number of those cases lead to hospitalizations. A certain number of those hospitalizations lead to death. That's what we see in the 70 to 79-year-olds. And the other one I made so far is this one, because everybody talks about cases in our children right now because we're mask mandating and all that nonsense again, and they're talking on the press conferences about, oh, the children are getting sick and they're hospitalized and all of this horrible stuff designed to scare parents into masking their children, vaccinating their children, and all these things. Now, this graph shows just cases and hospitalizations. And the reason I don't show deaths is because in this group, only 7 deaths have been reported associated with COVID-19. Now, I've seen the actual cause of death for 4 of those from last year. One was, I think, a 1-year-old that died of positional asphyxiation. Another individual had an incredibly long list of other health issues. Another one just said simply COVID-19 with nothing else. No pneumonia, no nothing. No other thing, just COVID-19. I think it was an 8-year-old. Just COVID-19 died of COVID-19. No other explanation. And one was a 19-year-old that had Rett syndrome as well. So these are not healthy kids. They have a lot of issues. And I don't know what the last 3 were supposedly, but the last death in a person under the age of 19 and under, was in March of this year. So I didn't even put deaths on here because you wouldn't have been able to see it. So this is just hospitalizations and cases. Now, there are a couple things to notice about this particular graph. Now, if you go back, whoops, not like that.
She went back all right. And I like Kara's comment, Far is rolling in his grave. Yes, he is. He is not a happy.
He is not a happy man right here. So he should be a happy man about this. This is pretty far-y. But so again, we're looking at this shape. This, Farr's law, it's pretty old. We know this. And everything looks correct here. This looks quite reasonable. Over here, what we see is cases. They go up. But look at those hospitalizations. They stay totally flat. They don't go anywhere. Why are they flat? It's because these hospitalizations do not represent illness. These cases do not represent illness of any clinical significance. This is quite simply testing. And you can actually even kind of confirm that, because if you can, do you see my pointer there? Do you see it, my pointer?
Yeah, I see it.
All right. So right here, you can see that super sharp edge, right?
Mm-hmm.
That's not how it works. There's no super sharp edges. It rises gradually over time. So what is this super sharp edge? This is November 1st. November 1st was the date that Governor DeWine allowed antigen test positives without symptoms or epidemiological link to be just straight out considered a true positive test, that it is a case. Just a positive antigen test is a case. Exactly here. So this whole chunk up here and a lot of this top stuff over here, that's antigen test positives on our kids. So these are screening tests on asymptomatic kids. And that's why it doesn't match down here where the hospitalizations are happening.
And that's why we've also started, we've just shut down the whole case discussion period, because in Ohio, we can't. It's not relevant.
No, cases are, when they talk about cases on the TV, it's a joke.
Right. We just don't even discuss it. We've got too much to do, and we've never operated a pandemic like this. We've never responded this way, and it takes us away from what we need to focus on, which is who is dying and who is really sick and what can we do. And that's, to add all this in, you could never have a good trajectory ever. So you just can't.
Yep. And here we are. Who's dying? We're seeing even, I have, like I said, I haven't done all of the different age groups yet. So I don't know. I haven't figured out where all the increases are happening. So I'll go through all of them and see if I can figure out where the increases are happening. But we're even here, we're not really seeing much change, much increase or anything like that. And we're definitely not seeing an increase in death.
With any disease, your pathogen, disease, whatever, you're always going to have outliers that, you're going to get some that there's no other scientific way to explain why it hit them as hard as they did, and why they didn't survive, or why it was really hard on them. But for the most part, in general, this is so spot on that it makes my eyes twitch, and that's pretty sad. And you're not even done with it, right? You said?
No, I've only done the 2 age groups. 0 to 19-year-olds, so children who they are now threatening and saying, oh, you know, COVID is so dangerous. Well, no, the data says your cases do not translate into hospitalizations, which tells us they are not connected. And most likely the vast majority of those hospitalizations that we see along the bottom on this graph are incidental. So hopefully some people will be able to take this kind of information to their...
Yeah, you've already got a couple people. One is Lori that can do it her own doggone self because she has an Apple product. But you've already, beyond her, the other ones I don't know. I pick on her because I know her and like her. That are asking for that 0 to 19 age to be clipped, everything that you just said. I don't know how to clip those things, but I know that there's the technology out there to do it.
I've got it. I just don't have the time. This is also a shout out to anybody who wants to help, even if you're not technical in terms of the data and stuff like that. There's a lot of just basic data stuff and video editing and stuff that I just physically, I'm physically out. I physically can't do it.
Do you have any more data?
What's that?
Do you have any more data for tonight?
The only thing I wanted to talk about to kind of for a laugh is the situation of you know what I want to talk about. So shall we do that as the final thing and let Josiah talk a little bit about 248 before we?
Yes, there was a couple. Yeah, because there was a couple questions in the comments about 248. And I don't know those answers. I'll never be able to answer those. But Josiah is the person that could.
Sure, I'm more than happy to jump in. So House Bill 248 will be having a special recess hearing on the 24th of this month at 11 a.m. I think they're going to have 4 hours of testimony going back and forth between proponent and opponent. I don't remember the deadline to submit. I think it's the
20th. The 20th.
Of course, Kathryn would know that.
And then I did find out today that concurrently with the hearing, they're trying to have a protest rally starting at, I believe, 9 o'clock in the morning, going through most of the day. But obviously that's all depending on people showing up. So if you feel like making a ride to the State House and protesting on behalf in favor of 248, be more than happy to see you. And if you see me or you see Kylo, come by, say hi. We have no problem talking to you. But I think things are plugging away. It's just, it's slow and it's politics.
I'll be going, so
we will see you then.
Okay, one way or another, whether I testify, whether they choose me to testify or not, I will definitely be showing up on Tuesday, because this is now you have to make a stand, and it has to be visible. It has to be undeniable. There needs to be large numbers of people there showing up, because we're not going to get another chance.
What I'd like to see, I don't know if you guys remember, but does anybody, whether in the comments or either of you, remember the massive numbers of people that showed up for the first 4 lockdown rallies?
Yes.
If we could get that kind of turnout at the State House for the 248 protest, that would be phenomenal.
So for
all the hospital workers, all the people who now understand.
Can you imagine if all the hospital workers in Columbus just didn't show up to work for one day?
Right. Josiah, they're asking, do we need to resubmit a testimony if they did one last time for 248? No.
You're not allowed to resubmit it. If it has already been accepted, you cannot submit another one. So if you believe that your testimony was not received, go check, and if you see it there, then you cannot submit a second one. But if you don't see it there, then yes, you can submit another testimony. This is actually one of the reasons why I didn't submit testimony back in the spring, because I didn't believe that it would pass in the spring, and that I suspected that exactly what is happening now would be happening, so that hopefully it's a little more impactful now when people are realizing that no, it's not a conspiracy theory, it's happening. There are going to be 2 Ohio's. There will be discrimination. There already is discrimination, and this is it. There is nothing after this. You make a stand now, and you do it now.
And it looks like too that it looks, and I don't know because I'm just learning about this, but of course I'm reading the comments because that's my favorite part. That on the 24th, this is taking place for 248, but it is a demonstration, not a protest. So
technicalities.
I don't even know.
Well, I mean, it depends. If all the hospital workers in Columbus show up for the demonstration, it's actually a protest. So I mean, it depends on who shows up. I would love it. I would love it though if we could get a huge show of hospital workers.
Right,
and I remember during the lockdowns they had a protest for the doctors and nurses, and there was like 15 of them outside the State House. I don't know if any of you remember that. I would like to just see a groundswell, if we could, of nurses and doctors on the 24th at the State House.
So, and I think that's the other thing that for people like me that are not in the political arena, I would shy away from protest, me personally, because I don't. But a demonstration, if I'm for something and I'm supporting something, then I'm more likely to get involved because I try not to. I just don't feel comfortable enough to protest.
Oh, I understand. So for now, we'll call it a 248 demonstration.
Gotcha.
So that's a good way to put it. Carrie. Yeah. Now that it's a demonstration and not a protest.
But with that being said, I also will be submitting testimony on the 24th myself, which is probably something I'll be very honest. If you asked me 2 years ago, absolutely not. Absolutely not. I would not have for something like this. But here we are 2 years later, and we've collectively lost our critical thinking component, and things are happening to people that are not okay. And you should have a choice. If I've learned anything, not only from Josiah's testimony at the state when I was fortunate enough to get to hear his testimony before, but now just personally is there needs to be a choice. There needs to be a choice. I don't care what it is. If I walk into the ER and say, for whatever reason, I can't take blood, as hard as that is on a healthcare worker, and I've been in that situation where I know I can save you and I know I can help you if you just accept that blood, I still have to respect that. And I think being on this side of it has given me a new perspective. And so I will definitely be submitting testimony in support of 248.
Absolutely. And one of the other things I would say is obviously we encourage everybody to keep in contact with the representatives. Write testimony, submit testimony if you haven't already. Show up to the demonstration, but also call Representative Gross's office and support her. Tell her how much we appreciate her carrying this bill, and then Ohio still stands behind her. Because this isn't easy right now.
It is not. Somebody said, what type of testimony should one submit? There is, and I'm sure Josiah, can you put it in the links? There, you can do written testimony. I will not be able to attend because of the day that it is. But that you can do written testimony. You don't have to be an expert in any field.
Tell your personal story. Tell
right.
If you are not an expert or can't claim at least at some level in that way, the better way is the personal stories that you have been experiencing in terms of discrimination or things of that nature. Whatever your personal testimony is, that is powerful.
Well, like I've always told everybody that have asked me before about testimony, nobody can tell your story like you can.
Yes.
Somebody told me that, because I will tell you, for my very first time ever doing that, it was extremely intimidating. I was very nervous. And I don't know who's playing piano, but they are rocking. And you tell them that I think that they're fantastic. But I was very nervous, and it's very intimidating. You don't know where you're going. Here, there's a parking garage, but it's underneath the building. It was just not good for me personally until I got there. And once I got through it, heck yeah, I could most definitely do it again. And I didn't feel qualified because I I didn't know what the heck what of me of all people. Mm. Um, but again, if I've learned anything, they put their pants on one foot at a time, just like everybody else does. So it's okay. Tell your story
Tell
because your
yours.
story may become somebody else's survival guide one day.
Yes.
Um, and I'm getting a lot of notifications asking, "Hi, Erica. If anybody's seen, of course, we are a live show, so you will see my children walk through." And so that's how you know we're live. But I've gotten a lot of questions about what is going on with the ventilator situation. So real quick before we get off here, um, I don't think it was very well uh, translated to the general public during COVID that a ventilator is can be NIV, which is non-invasive, or a tube in your throat. So non-invasive means you don't have a tube in your throat and it can come off or go back on. So you have things like CPAP, BiPAP, NIV, um, or the traditional, what everybody thinks of. There's a tube in your throat breathing for you. Way their own PCR test. And what was that? I just heard myself talking. Kathryn, you have to stop it.
Sorry.
It's almost 10 o'clock at night. So, but anyway, so we have then had a difficult time getting that. There was a huge recall on Philips of all CPAPs, BiPAPs, trilogies, NIVs, and some vents. In the state of Ohio, for whatever reason, we were told that these ventilators, NIVs, all of these, once they were able to be back in circulation again, they would then go to the facilities first. And I said, wait a minute. So that means there could be a machine in a closet stockpiling, replacing what we didn't have in a facility while a patient at home needs it. That doesn't make much sense to me. Whatever patient needs it, that's who needs to have it. So we've been kind of doing this back and forth battle with them. And it was aired on a southern TV station, not up here where I live. But since then, we have gotten quite a bit of people reaching out. That was the first time in 18 months I've heard from my own representative, which was Dick Stein. I've heard from others that are not in my area, do not represent us, and several other people. I will say all of the shares and of just me venting, and I had absolutely had it on Twitter and Facebook. That's what made that difference. That's why that story was picked up by a news outlet, and that's why it was aired. And so I would like to thank, on behalf of my entire family, everyone that takes the time out of their day with so much going on to reach out or to just, do something as like sharing and commenting or tuning into to this. Those things, one, make us remember we're sane and not totally crazy. And two, make sure that we understand that we are not alone. Um, and so I appreciate it. Thank you all very much for that. We still do not, I get, is there an update? No, we do not have the machine. I am going to be having a very colorful meeting tomorrow with several, at the state. Of course, it's by phone. Yes, that's what it was. WLWT in Cincinnati. Thank you for that, Cheryl. Um, so as of Friday, they did not have a timeline when we could expect one. And I received an email, and the top of it said COVID ventilators. And it said, hospitals are receiving some at first dibs. And I'm still not clear because, as Lori said, punctuation is important. So I'm still not clear on any of that, what that meant. And so tomorrow will be interesting. I don't really have much of an update other than we still don't have it yet. and they're just not there because of this huge recall. So it has been paid for, and then I, did go ahead and put a stop payment on it because I didn't receive it, and they have no idea when I'm going to get it for him. So that's kind of where we are. I think that's horrible that we would do that to any patient in the state of Ohio or in any state. If a patient needs something, you get it, you figure it out. So the level of incompetence has exceeded the level of my patience. So tomorrow, if anybody in any state of Ohio sees a TV station, and you just never know if I'll be on there or not. So,
hopefully not. We're hoping
yes,
not.
Nicole, you are correct. Mount Carmel East is one of them that does have a closet full of recalled ventilators. And we were told last week that they're looking at probably a year before that they will be replaced. Several in the state have actually been instructed by Philips to just throw them away, depending on what they are, if it's a BiPAP, CPAP, or vent. So there's a lot of that stuff going on. So I'm sure with this respiratory virus that we typically see in the wintertime, such as RSV, there probably is a lot of nervousness happening.
A true, genuine, real shortage in ventilators that has nothing at all to do with COVID and everything to do with the fact that Philips has known for years that their foam in these respirators, that is the majority of respirators, specifically in the state of Ohio, is deadly and causes pneumonia.
Right. And yes, then that's the question. That's what I was just pointing out. And that was my point. That was my question this past week. Okay, so you just used Cleveland Clinic as an example of it being a full Philips product. They only contract with Philips, which makes sense. Philips is the largest manufacturer. Fine, I get it. And the thing is, though, Christina, when you say vent, it's not just a tube in the throat. It could be a BiPAP or a CPAP. A lot of COVID patients are using that. That's NIV therapy. So whenever you have that NIV therapy, some do need that, and they do have a good response to that. Not the counterproductive is a true vent usually that goes in the throat when they have to sedate them just to vent them. That's where you have some counterproduction. So Cleveland Clinic, right? Yeah, and Cleveland Clinic, I don't know how many COVID patients they had. On my or on their COVID floor. But knowing they used all Philips products, and any product made by Philips was recalled if it was made prior to April 2021. So last year, when they were on these machines, and we now know that they can have carcinogenic agents from this foam called respiratory infections such as pneumonia and respiratory failure. How many of those COVID patients that were on a recalled machine
died from the machine and not from COVID?
Right. Will we ever know? I don't know. Has that question been answered yet? No, it has not been answered. Regardless, there should be a comparable machine from somewhere. I mean, Philips is not the only manufacturer just because it's the largest. And that's where the issue is coming to be. So they do have an EUA for one in the facility that is able to be used, but not for pediatrics.
Which is why we're having a pediatric vent shortage, because we have a combination of true RSV, which frequently requires ventilation, and we have that massive recall, and we do not have a replacement for pediatric vents.
Correct. Yep. So anything manufactured, if you look at the recall, Tina, it is from everything was recalled that was manufactured prior to April 2021, and there are multiple CPAP, BiPAP, NIV therapy such as Trilogy, and even vents. So if you get on the Philips website, and I mean it is pages and pages long.
They've known about this for years, and so yes, there's a question here: was the ones made in 2020 as well? Yes, they knew about the issue in 2019 at the very
Right.
latest. So they knew.
Yeah.
They knew.
So what happened is they stopped because of this huge recall. So they told the FDA in April, looks like we might have a problem. They did a voluntary recall in June, and the FDA did not. It's the most serious of recall, but the FDA did not recall it themselves. They didn't say you have to stop. The company did a voluntary. But when they did that, they also they just stopped the way that the respiratory therapist explained it to us. So even pieces and parts for other ones, if you need those right now that aren't recalled, they're very difficult to get. Very difficult, very backlogged and back ordered. And in Ohio, right now, that suit, I see it, they better be sued. They better be sued. There are suits definitely taking place, class action suits, every place but Ohio, because we have a 606 bill. And if you read the 606 bill really good, we can't do that until it expires.
So we should add that one to our next Beyond the Data, because
right, absolutely,
people are falling asleep. Should we?
Yeah, I'm falling asleep.
Should we do the somewhat comical ending to our little?
Yes, we need to do a comical ending, and yes, Shannon, it could very much be under their COVID rules. We don't know because there's no numbers, but yeah, let's see the comical ending, because we need to end on something that will make me smile.
On at least make you both be angry and laughing at the same time.
Oh, because I'm not even angry enough. I told you, Jesus on this shoulder, jail on this shoulder, and it's always, which one am I going to pick when I open my mouth?
So first, I'll play a very short clip from last week's press conference. Okay, so just listen and internalize.
Bottom line is that today, COVID-19 is essentially a vaccine-preventable illness.
So it's a vaccine-preventable illness. So this popped up a couple days ago, or not a couple days ago, yesterday. Andy Chow, who is a reporter for the Ohio channel, who actually put together a nice little story about me and some of the other people who testified for SB 22 and saying that, we use statistical fallacies and things of that nature. Well, he just tested positive for COVID and with symptoms, fully vaccinated, careful, all those things.
And I truly believe he was probably one of the most careful individuals while there was a camera rolling that he quite possibly could be. There's no doubt in my mind. He's a fantastic individual.
And that's not all of it. I only pulled one of these stories up because I didn't have time to pull the other ones. But these stories are popping up everywhere, and this one in particular made me laugh, because it's just like, I don't even know what to do with this. Here we are. We have a fully vaccinated, and this is not in Ohio. I forget where. I think this is Florida or Texas or someplace. But fully vaccinated man dies of COVID-19. And down here it says a woman's fully vaccinated father died from COVID-19. Doctors said the condition of the father could have been worse if he wasn't vaccinated at all.
And I don't understand that. Like, what is worse than death? Like, my heart breaks for all of these people, because losing someone is traumatic, no matter what choices they made in life or didn't make. It's horrific. But what is worse than death? What you mean it could have been worse? Like that, here we go again, Jesus in jail because my mouth.
Well, they're just
what does that mean?
They're just still pushing the vaccine, even with that, because it could have been his death would have been so much worse if he wasn't vaccinated somehow.
So I don't are you a little dead or a lot dead?
Mostly dead, apparently. I mean, it's so ridiculous. It's just like there is no more connection with reality. Now it's become this thing of, it's become normalized that it used to be, there was DeWine out there saying, 100% protection if you have this vaccine. And now we've moved from 100% protection to, well, it could have been worse. And so we had a lot of those stories where it could have been worse. I mean, it was only sniffles and a headache and whatever. But I mean, I'm so glad I got the vaccine, because it totally would have been worse. And now we've proceeded to this level where we're looking at individual fully vaccinated tragically dies from COVID, and they're still trying to work the argument of it could have been worse than death.
Yeah, I don't understand that whole, like, I don't get that, and of course I can argue for days with what data are you using that says that it would have been worse without the vaccine? Of course, that's the thought process, the intent. But show me at this point in life, show me that the data, because I'm not trusting any that's coming out of here. But then you see something like this, his death could have been worse. So I hope, on that note, that everybody, is that the last one you have?
That's it. Okay. There were a couple stories. There was another younger woman. I believe it was a 48-year-old woman, I think Texas, who also had multiple issues, but she also, unfortunately, she also died from COVID, also fully vaccinated and the works. And I think they said essentially the same thing, that get your vaccine, because their loved one.
Y'all can have mine too. I'll give it up. But I will definitely, for the good of the people, y'all can jump in line and get that in front of me, because if that's what you choose, that's what you want, I respect it. But when I see things like it could have been worse. So on that note, I hope everybody has a could have been better than death week until we see them and talk to them again, whatever day that Kathryn decides. I'm day to day with what's happening here. So
hopefully, I mean, we're definitely going to stay, I think, pretty steady on Sundays. Sunday night seems to work very well overall, and I'm hoping that we can pull together our thing specifically on schools and kids, and that this week hopefully we won't have any more problems in terms of arranging it with the people who are joining me, and get that going. Most likely we're also going to have a short little one about the process of data collecting, because we are in need of more warm bodies to help us and help keep everyone sane. And this is also a job that doesn't require any kind of technical knowledge at all. It's something that even older kids and college students could do easily, but at the same time, it's something that we critically need help with in order to keep bringing in and collecting the data from the Ohio website and making sure that the people who have been doing this for months now don't get burned out. And so we'll probably do another live with some of my data collection people and show what we're doing, how we're doing it, why we're doing it, and how you can help. So hopefully that will come up this week. If not, definitely next Sunday we'll be doing it again.
Shout out to Josiah for coming on and hanging with the chicks tonight.
No problem. Thank you for having me.
Definitely Lanning for Ohio.org. Yes. It looks fantastic, and I'm going to be stalking and following them around a little bit and running my mouth.
Check out the Meet Kylo page, too.
Yes, I love it. All right, you guys have a good night.
You too.
Good night, everyone. Thank you for joining us.